Hey guys, it's Aiden here making another video. Today I want to talk to you guys about psychiatrists and medication and side effects and things like that. I get a lot of comments about those subjects, so I wanted to make a video about it. So let's get into it. So a lot of my viewers have come to my channel because of my psychosis videos. So a lot of you watching may have experienced a psychosis or maybe other kinds of mental health issues. And so you may be on some kind of medication or in some kind of treatment for mental health. And before I get into this video, I just want to disclaim that this is for educational purposes only. I'm not trying to tell you what to do. I'm not a medical professional, so don't take any of my advice without consulting a medical professional because I'm not qualified. I'm just speaking from my experience, so just take it as that. So now that that's out of the way, I get a lot of comments about people talking about medication and side effects and how the side effects are really bad and they want to get off the medication. And I sort of talked a little bit about this in my videos saying that psychosis takes a while to recover from, but I wanted to address specifically the medication issue of it because I think a lot of people who go into a psychosis and maybe have these symptoms and get put on medication, the goal for them is to get off of medication because of the side effects or for other reasons, and they don't necessarily consult their physician or psychiatrist. They just go off of it on their own. And in this video, basically what I want to talk about is that you are in charge of your health and your mental health and stuff like that, as long as you're able to make rational decisions. If you're in a psychotic state, then you need people to take care of you. But as far as your recovery process goes and as far as your medication goes and things like that, that's something that you can discuss with your psychiatrist, with your doctor. It's not something that your doctor will tell you this is what you need to take, and that's like the end all. If you go back to your doctor and talk to them and have a relationship with them and share sort of what you're experiencing, like these are the side effects I'm experiencing and it's really hard for me to deal with. Is there any way we could change the medication or find a new way to work around this so it's a little bit more manageable for me? Not only will you feel better because you feel like you're expressing sort of the feelings that you're having and the side effects that you're experiencing, but you might actually find a combination or a different medication that might work better for you with the guidance of a medical professional who can sort of guide you through that process instead of you trying to do it on your own, where you just get off of the medication and end up relapsing or having negative impacts from that. And it's possible that everything goes okay, but it's better to do things like this under the guidance of a medical professional, obviously. So always talk to them about any insecurities or problems that you're having with your medication. And this is something that I saw not only with myself, because I went off the medication the first time and I sort of did it with the psychiatrist, but a lot of it was me saying like I want to get off of it, and so I did, and I was fine for a while until I started smoking pot again, which I learned the second time that that's something I can't do. And I'm still on medication currently, just a low dose of Risperdal, 0.5 milligrams, and that seems to it helps me out, helps me to not have to deal with as many symptoms from the bipolar disorder and keeps me kind of level for the most part. But I also noticed this same trend when I worked at the suicide hotline. I worked there for a little bit less than a year. And I spoke with a lot of people who were struggling with a lot of different mental health issues. And a lot of them, this is sort of where I noticed the trend, a lot of them who are, a lot of the people that I spoke with who are on medication and struggling and feeling depressed and the medication wasn't helping, a lot of them wanted to go off of the medication and I would ask them like, hey, did have you considered like telling your psychiatrist about some of the things that you're experiencing, the side effects, some of the depression? And a lot of times they would say no. And so my guess is that if I'm seeing that trend on the suicide hotline, I'm sure there's some people maybe who are watching this video who may have a similar experience where they feel like they don't have a voice, where they feel like they can't really, that they're sort of struggling with the recovery process, but they don't feel comfortable articulating that to their providers. And I'm just here to tell you that it's important that you do share that information, because if they don't know what's going on, they can't really help you. You can't really have a relationship and understanding what needs to be done in order for you to feel better. So basically, what it comes down to is, make sure you're talking to your providers about your recovery process. Make sure you're communicating with them about the side effects, and make sure that you feel like you can express your thoughts and opinions. And if you want to try changing medication, talk to your psychiatrist about that. That's something that can happen, but a lot of times you have to ask for it, because if the psychiatrist doesn't see that there's something wrong, or that like you have an interest in changing medication, then it probably won't happen. And obviously some of these medications do have side effects, and they're not ideal, and sometimes you have to weigh the side effects versus the benefit of not having a psychosis again, or having the side effects of whatever mental health issue you've got going on. And that's something you have to figure out where the balance is, so you feel like you're comfortable and you can sort of function in the way that you would like to in your life. So there's never, like, I think sometimes it's not always a clear answer, but if you have an open communication and a relationship with your support system, then I think it does make it a little bit easier, and it might make you feel a little bit better about your recovery process. So with that, I hope you enjoyed the video. If you have any comments or questions, go ahead and put them in the comment section below. I'd be glad to answer any questions that I can. And I hope you guys find success in your recovery process, and are able to have an open and healthy relationship with your medical providers, your healthcare providers, to make sure that you're getting the care that you need. So with that, thanks for watching, and make sure to take time for yourself and to seek your truth, and I'll catch you in my future videos. Bye for now.